Hey everybody, welcome to Pick Dr. Osborne's Brain. Got a great show for you tonight. We're going to be talking about the red-headed stepchild of detox organs in the body, and that is the kidney. Very, very few people talking about the importance of kidney function and the role it plays in detoxification. Most people are very, very focused on the liver, so I thought we'd give the attention to the kidneys that is deserved by these two very important vital organs of function. So if you're new to the show, make sure you chime in. Let me know where you're tuning in from in the world as always. And appreciate any kind of likes, loves, thumbs up, or hashtag save 100 million lives you guys can throw our way. So let's dive in a little bit with the kidneys, right? So kidney function is super critical. It does a lot of different things. Let's talk about some of the basic functions of the kidney before we dive into some nutritional tips related to how you can preserve and help your kidneys to detoxify at their fullest capacity. So let's talk about kidney functions. I want to go ahead and throw a slide up on the screen for you here. And so we're going to talk about some of the basic kidney functions. So number one, kidneys filter your bloodstream. So your blood, as it's constantly pumping, it's pumping through your kidneys. Your kidneys are these massive filters that do a lot of filtration of your blood. And then, the excess of that, the excess that comes out, many chemicals, many different types of agents that if they stayed in your body would potentially be harmful or damaging, right? So detoxification through that filtration system. So kidneys filter predominantly what they're filtering is they're filtering your blood. They're filtering the different elements in your blood. Remember that we talk about, for most people, true detoxification, you have the liver, and the liver, what the liver does is it turns different chemicals into water-soluble compounds, and those water-soluble compounds are part of the blood, and so as your liver converts them into water, they can then be filtered through the kidneys, right? And that's, again, it's kind of a 1-2 punch. Your liver has to filter some of these chemicals, or at least convert some of these chemicals first, and then it's up to your kidneys to filter the blood. So we want really strong functioning kidneys. One of the other functions of the kidneys is the acid-base balance. So your kidneys are very critical for maintaining the adequate pH of your bloodstream, in your urine as well. So the acid-base balance of the body, very important. Also, electrolyte function. Your kidney regulates water balance. So water balance of the body. Any of you ever had swollen feet? This is one of the hallmark symptoms, or can be, of kidney dysfunction. That's a lot of times because the kidney's not properly holding, or it's letting go of too little water, and so we have a holding on of water through abnormal electrolyte balancing, and so then that water can kind of pool into what's called the interstitial fluid in your feet, and it can lead to swelling, not just the feet, also the hands and the skin itself. So puffiness or swelling, common side effect of kidney dysfunction, but that's through the function of the electrolyte balance. Now, the kidney also produces a hormone called renin. Renin regulates blood pressure. So this is why sometimes doctors will give you medications to control blood pressure. It's actually through there's a type of hormone downstream from renin called angiotensin, and so sometimes doctors will give you blood pressure medications to affect that. And so again, renin is produced by your kidneys, which helps to maintain and regulate your blood pressure. There's also a compound called erythropoietin that your kidney makes. It's a hormone that drives or increases the production of red blood cells from the bone marrow. So kidney plays a role in that as a function. Kidney also plays a role in activating vitamin D. So vitamin D has to be activated by your liver and your kidneys. And if you don't activate that vitamin D, then what can happen is your vitamin D, one of its main functions is it tells your intestinal lining to absorb calcium from the food that you eat. So when your vitamin D levels are really low, what can end up happening is your bone density starts to drop, or you can develop problems. That's why diseases like vitamin D deficiency in children can cause softening of the bones, a disease known as rickets, In adults, it's also called osteomalacia. Same disease, just different names with adults and kids. But that, again, without good kidney function, you lose your ability to activate vitamin D, which is one of the reasons why we see elderly with kidney dysfunction have a really, really hard time getting their vitamin D levels up to where they need to be. And oftentimes, even with supplementation, they still continue to struggle because a lot of doctors don't actually use enough vitamin D to make this happen in the case of somebody who has kidney dysfunction. So these are some of your big functions of the kidney, which, again, detoxification by filtering the blood, acid-base regulation, so regulating the pH of your bloodstream. Remember, pH balance is very, very critical for normal function. Electrolyte and water balance, the regulation of blood pressure, the regulation of how many red blood cells you produce. Remember, what do red blood cells do? So they carry oxygen, they carry O2, and without oxygen, you become anemic, right? You become lethargic, brain foggy, slow, muscle pains, muscle aches. So we got to have good functioning kidneys. And lastly, activating vitamin D. So kind of in a nutshell, that's your kidney functions. Important to know those things as we talk about what you can do to better nutritionally support your kidney. Now, I want to talk some as well. Let's throw up slide number, let's see here. Let's throw up slide number, that one right there. Yeah, gluten causes kidney damage. So let's talk about, actually, no, I want to skip this. Sorry, Mel. Let's go to the next one. Let's go to lab tests because I want to really throw in some lab testing for you because these are the functions of the kidney. So how do you get your kidney evaluated? If you want to go to your doctor and get your kidney evaluated, what are the tests that you can run to determine whether or not your kidney's functioning properly? So I got a slide for you on this as well. But one of the main tests is called creatinine, not creatine, like the nutritional supplement for people who try to build muscle. Creatinine. Okay, so this is a blood marker. This is in your blood, and it's measuring how well your kidneys are filtering this breakdown product of your muscles. So your kidneys are supposed to filter that out, right? And so creatinine is one measure, one marker in the blood. There's another one called blood urea nitrogen, or BUN for short, also a blood test that helps doctors understand whether or not your kidneys are functioning adequately or starting to fail. There's another marker called GFR. Now, GFR stands for glomerular filtration rate. This is a marker for the glomeruli, which are the functional units of your kidney's filtration ability. And so this can be calculated from your creatinine. But if you want to run it and get an accurate assessment, to get a true GFR, you can do what's called a urine creatinine. So the same test up here, urine creatinine over 24 hours. But GFR is oftentimes calculated based on your blood creatinine. So you can also do what's called a calculated GFR, which is basically, it's just it's an estimation. Instead of having to pee for 24 hours in a bucket, doctors can run your blood and measure creatinine, and through a formulaic process, they can calculate your estimated GFR. So these are lab tests that many doctors will run. There's also another urine test called albumin, which is an indicator. Albumin is protein, and so this is in the urine. And if this is spilling into your urine, it's a marker that your kidneys are damaged, because albumin is supposed to be some small amounts of albumin will come out in your urine, but predominantly it will stay in your bloodstream. So your kidney won't filter the albumin into the urine. It will keep it in the bloodstream. So it filters your blood, leaves the albumin in it, unless it's damaged, in which case we see albumin and another protein called prealbumin leaking into the urine. Again, markers, all of these are markers potential for kidney dysfunction. So what happens to most people is they go to their doctor, and these three right here are super standard. Right, the creatinine in the blood urea nitrogen, and the GFR. Those are really standard tests that get run. The actual albumin in the urine, unless you see a nephrologist, this is probably not a test that your average doctor is going to run. Creatinine over 24 hours is also not a test your average doctor is going to run. Usually those are kidney specialists, kidney docs, that are going to run those two. But these top three are some of the primary ones. So again, if your creatinine is too high, it can be a problem. If your blood urea nitrogen is too high, it could be a problem. And if your GFR is too low, it could be a problem. So those are, again, kidney function tests that you can ask your doctor to order on you if you feel like you're struggling with a problem. So let's talk about whether you might be struggling with a problem. Let's throw up the slide on kidney dysfunction symptoms. So I want to talk a little bit about some of the more common symptoms associated with kidney dysfunction. So I mentioned this earlier, and that was swelling of the ankles. So swelling, but again, it doesn't have to be just isolated to your ankles. If your feet get puffy, if your hands get puffy, if your skin gets super puffy, these are all potential reasons or potential symptoms that your kidneys could be improperly excreting fluid. This is why a lot of times you go to the doctor and you're swelling. Sometimes they give you what's called a diuretic. And so that's a common treatment, right? A diuretic, because it helps what? It helps to your body, your kidneys, to excrete more water, so it takes that water away and reduces the swelling subsequently. Increased urgency to go to the bathroom. So increased urinary output, increased urinary urgency. This is super common with diabetics, right? One of the hallmark symptoms, of diabetics is increased need to urinate and or excessive urination, and that's because their kidneys are working extra hard to filter out all the glucose. Again, the kidney's a filter, right? So all that sugar floating around in the bloodstream, the kidney's working extra hard, and so you're producing a lot more urine to try to deconcentrate that glucose that's coming out. And so your kidneys work harder in that regard. So you urinate more. So it's a sign that your kidneys are being damaged by glucose, which is one of the predominant things that actually causes kidney disease, is excessive blood sugar or excessive glucose. Additionally, symptoms, blood in the urine. If you've ever had blood in your urine, this is a potential problem. It could indicate a kidney infection, right? So like a bacterial or a fungal infection of the kidneys. It could also indicate a major kidney function issue. Now, I was talking about tests a minute ago, and one of the things I didn't even bring up was a urinalysis, or a UA. And that's another test that's very common that most doctors do. This is, again, where they take a urine sample from you, just a standard urine sample. One of the things they do look for in that is they look for blood. So if you've ever had a test come back where you had blood in the urine, and there was no other discernible reason why that blood might have been there, that could also be a marker for problems in your kidneys. Now, remember we said earlier that your kidneys help maintain electrolyte balance, and that's why this next symptom, which is muscle cramps, can happen, muscle cramping, because with poor electrolyte preservation, the muscles can actually start to cramp. You can get twitching muscles, eyelid twitches, shoulder twitches, involuntary, thigh twitches. Some people get severe cramping that occurs at night or in the daytime, but at night it's kind of a hallmark that can happen at night. So the kidney dysfunction, again, muscle cramping. Now, not all muscle cramping is kidney dysfunction. Sometimes the muscle cramping can be nutritional deficiency. So again, it just depends. This is a symptom potentially of kidney dysfunction, but not an end-all be-all. So additionally, trouble sleeping, not being able to go to sleep, insomnia. This has a lot to do, the insomnia has a lot to do with the acid-base balance component of what your kidney does to help you function. And then we also get puffy eyes. That's part of the swelling, right? So puffiness around the eyes, itchy, dry skin can also occur. And some of that has to do with the puffing or the swelling of the skin. As you retain more water, the skin is stretched. It can become more dry as a result of that as well, but also because of the dehydration component, that dryness. And then loss of appetite. So reduction in wanting to eat or reduced appetite. So these are kind of hallmark symptoms. If you have everything on this list, you probably need to go have a conversation with your doc about that, because, again, everything on this list could very well indicate that you might have a kidney problem. So again, these tests, ask your doc. Creatinine, blood urea nitrogen, GFR, urinalysis are the common ones that they're going to run, but make sure they're running it. I've seen cases where people go in and the doctors won't even run a test. They just kind of give them a medicine. They go in, they have swelling in the extremities, and they're having trouble sleeping, some of the hallmark symptoms. They walk out of the office with a prescription, but no lab work was run. It happens on a pretty frequent basis. You'd be surprised at how often that actually can happen. So my advice would be, if you're going to see your doctor, just ask and inquire about the lab tests. Most doctors, if you ask and inquire, they'll actually run it. It's if you don't, sometimes just because they may be in a hurry or they may not have time today, they just don't run it. And again, I don't think that would be necessarily even be something malicious that they're trying to do. Obviously, that your doctor's not trying to be malicious, but sometimes you just have to ask. Sometimes you just have to prod them in the right direction in order to get them to help you and run testing. So again, a lot of doctors don't like to run a lot of testing. So ask for it, and you'll receive it. Okay, let's talk next. I want to talk a little bit about some things that damage the kidneys. So there are a number of different things that can cause direct damage to the kidneys. Let's make a column over here. And one of them is pain medications, non-steroidal anti-inflammatory medications. So if you're taking ibuprofen, for example, it has to be metabolized out by the kidney. Unlike many other drugs, a lot of drugs are metabolized by your liver. Some drugs are metabolized by your kidney. Some of those include certain types of antibiotics are metabolized by your kidney. Certain types of antifungals are metabolized by your kidney, and non-steroidal anti-inflammatories for pain and inflammation are metabolized by your kidney. So if you've got a history of kidney damage, and you're certain of it, like your doctor's treating you, maybe one doctor's treating you for low kidney function, and then another doctor wants to give you, one of these three types of medicines, always make sure you're aware of that these medicines, if your kidneys are already having a hard time functioning, these medicines can make it even harder and can create an even bigger problem. So don't forget it. Don't forget, write these ones down. So these things can damage your kidney. What else can damage your kidney? A big one is glucose. Too much carbohydrate, too much sugar. So I'm going to use this as an example because we've talked in the past about the grain-free, gluten-free diet. And one of the reasons why it works so well in people with kidney disease, we'll talk a little bit more specifically about gluten, but one of the other reasons it works so well is because it's a reduction. If you do it right, you follow no grain, no pain, you do it right, it's a reduction in probably the quantity of carbohydrates that you're getting. One of the sad fundamental facts of our society today is that organizations like the American Heart Association and the Food Guide Pyramid, some of these entities that basically give a one-size-fits-all dietary advice have basically told people to consume 60 to 70% of their total calories from carbs. And what that does is it drives up the breakdown of these carbs. It drives up glucose in the bloodstream. And so, if we look at like the American Heart Disease Association's diet recommendations, we kind of scratch our head and say, no wonder heart disease hasn't been really effectively battled in this country. I mean, it kills 1 million people a year. And despite all the advances in medicine, despite all the medications that are being used, we still have 1 million people a year dying. And a big part of that is their diet recommendation is conducive to causing elevations in glucose. Those elevations in glucose, you have to understand, there's a term called glycation. Now, if you've ever had a hemoglobin A1C test done, that hemoglobin A1C, some people refer to it in short as A1C. What that's doing, hemoglobin is a protein. Hg is abbreviation for hemoglobin. This is a protein that carries oxygen inside your red blood cells. Okay? And so what doctors are doing when they're measuring hemoglobin A1C is they're measuring the quantity of sugar or glucose that is wrapped around that protein. So glucose, basically, it coats that protein, makes it sticky. Okay, that's called glycation. When we have sugar coating something, that's called glycation. And what that does is it makes that red blood cell less effective at carrying oxygen. But glycation doesn't stop at hemoglobin or red blood cells. Glycation can affect your hormones. Glycation can affect the other proteins in your bloodstream. Think of glycation as pouring syrup into your bloodstream directly. So the more glucose you have, the higher the carbohydrate diet you have, the more glucose that hits your bloodstream. the greater level of glycation that occurs, the more disruption of blood proteins we have, the more disruption of hormones that we have, and it creates systemic-wide types of health issues. And that's why so many people are reducing their carbs, right? They're lowering their carbohydrates in their diet, and what are they seeing? They're seeing reversal, not reduction, reversal of diseases like diabetes. And again, diabetes is a disease of high glucose or high blood sugar, but the organ, well, the organs that's the second most affected organ in diabetes, okay, are your kidneys. A lot of people think heart disease, but it's really kidney disease. You know, a lot of the dialysis places that you see popping up on every corner in major cities, where people are going to the dialysis spa, where they're like going to a spa-like environment so that they can get hooked up to a machine, because their own kidneys are so coated with sugar they don't function as filters anymore, and so they have to go sit, you know, for 4 hours or 8 hours or however long their prescription is for. They have to go sit and they have to get dialysis for several hours a day, several days a week, in order to continue to survive, because their kidneys have been so damaged by that excess glucose. Now, I mentioned it's the second organ, right? The primary organ that gets damaged by blood sugar is the eyes. This is why a lot of diabetics go blind. They lose their eyesight, because the small microvasculature in the eyes, very tiny blood vessels, and it's generally speaking, when the blood sugar is high, it affects the smallest blood vessels first. That's where we start seeing the damage. So the eyes and the kidneys are the two areas that start to really show up as problematic for people who don't come to this type of conclusion. This, again, one of the reasons why no grain, no pain diet works so well when a person has diabetes is because the diet itself is about a third of the total calories are coming from carbs, or about 30% of the total calories coming from carbs, not the American Heart Disease Association, American Heart Association, 60 to 70% carbohydrate general recommendation. So again, lowering that glucose means we got to cut grain out of the diet, because this is what happens. Most people so vastly overconsume grains as a staple food in their diet that they're driving up their blood sugar, their blood glucose. This can happen with other starch-based foods as well. Things like potatoes can do this. If you're on a grain-free diet but you're eating too much tapioca, if you're eating too much arrowroot or too much yucca, like these are things that also will drive up your blood sugar. It doesn't have to just be grain, but again, obviously sugar drives up your blood sugar, but it's that carbohydrate, those starchy carbohydrates, that can really do this, creating that glycation, creating that kidney damage. And then when the kidneys start to go, right, so too do these different functions. We lose our ability to filter our blood. Our blood starts to become toxic. We lose our ability to regulate our acid-base balance. Our blood can become too acidic. We lose the ability to regulate water. We start to become swollen. We lose the ability to regulate blood pressure. Our blood pressure goes up and puts more pressure on our heart. We lose the ability to produce red blood cells. And so now we become more anemic, because we can't carry as much oxygen, and the red blood cells that we're making are being coated by sugar, so they don't work very well. So we become really tired all the time. We don't want to exercise, right? And so when we don't want to exercise, guess what? We don't want to exercise. It's really hard to get rid of glucose, because one of the main ways we get rid of glucose is by exercising our muscles. Our muscles' utilization of glucose is how our muscles get the energy that they need. So if we're not exercising because we're anemic and tired all the time, then this glucose goes even higher, right? But also activating vitamin D. Now, one of the functions of vitamin D as it relates to the kidneys and it relates to blood sugar is vitamin D is the primary agent involved in insulin production. Missed an I there. There you go. Insulin production. You need vitamin D. As a matter of fact, your pancreas has, I think to date, as far as we know, the most vitamin D receptors on any organ actually are on your pancreas. And one of the things your pancreas does, under the direction of vitamin D, so vitamin D travels to your pancreas and says, hey, we need insulin. And so then your pancreas responds and it says, okay, we can make insulin. Your pancreas produces insulin. What does insulin do? Insulin unlocks your cell and allows glucose into your cell, and that's where we make energy. And so if you don't have adequate vitamin D, again, lack of kidney function, lowered kidney function, you're not activating your vitamin D, you're not producing insulin as well, you're not getting the glucose out of your bloodstream as well. Your cells don't generate energy as well. So, you look at this anemia component with lack of oxygen, then you also add on top of that this vitamin D component with lack of ability to get glucose into your cell to generate energy. And now you're pretty much an energy zombie, right? You're just struggling, you're suffering, trying to get what you need. And so, again, exercise is the last thing that you want to do. And so this is where, at this point, most people, they go on mass quantities of medicines, right? Because the medicines that doctors use, like, for example, to control better insulin and glucose, doctors prescribe metformin. That's one of the primary drugs for diabetes. And metformin, unfortunately, metformin causes B vitamin, folate, and B12 deficiency and CoQ10 deficiency. And unfortunately, B12 and folate deficiency cause anemia. And CoQ10 deficiency causes elevations in blood pressure, which puts more pressure on your kidney, but it also causes congestive heart failure. So it puts more pressure on your heart. So over time, that's what this particular medication does to your nutritional status. So it actually recreates the very disease that you're taking a drug to try to prevent in the first place, but it recreates that through different mechanisms. The other things that we'll see happen, in this type of scenario is they won't just go on blood sugar drugs, but they'll go on blood pressure drugs. And so to lower blood pressure, because again, when the kidneys aren't functioning, we're not regulating blood pressure. And so the same thing goes. So some blood pressure medications, there's different kinds, but BP meds, some of them reduce B vitamins and electrolytes, like potassium. Potassium, calcium is an electrolyte, magnesium is an electrolyte. People don't realize that. And these medications can actually cause deficiency calcium, magnesium, potassium, okay? And that in and of itself can create a host of different problems. If you want to learn more about these minerals, you can go watch some of my crash courses on these particular minerals, but B vitamin deficiencies as well. And one of them, particularly blood pressure medications, will reduce vitamin B1, and vitamin B1 deficiency causes a disease called beriberi. Beriberi is a form of congestive heart failure. So again, trying to save the heart through the use of blood pressure medications, trying to save the blood sugar through the use of blood sugar medications, but the byproduct nutritionally of giving those meds over time is an actual nutritional deprivation that begins to set in that causes the disease that the doctors were originally trying to treat. And that's why nobody ever wins. That's why when people go on blood pressure medications and blood sugar medications, their diseases don't get better. Their symptoms change, or the values that the doctor's measuring in the blood changes, but they always have the disease. The disease never really goes away. They don't get rid of their diabetes. They don't get rid of their high blood pressure. Look, and we know the reality is diabetes, high blood pressure, heart disease, these are completely reversible conditions unless you have some type of rare esoteric genetic disorder in that area. These are completely correctable conditions through diet and through lifestyle. But again, as I mentioned earlier, the American Heart Association recommends a high carbohydrate diet and a low fat diet. So a high carb, low fat diet, right, which is the opposite of a low carb, higher fat diet to lower glucose, because fat has taken on most of the blame. So fat has been blamed for a lot of this problem. But anyway, I digress. So we want to understand that your kidneys can be damaged by certain kinds of medications because these different types of medications have to be metabolized by the kidneys. So if your kidneys are already not functioning, this could be the bad move or the wrong move for you. Kidneys are also damaged as a result of an abundance, too much glucose, right? Too much blood sugar. Like those are the main elements that can really damage kidneys. Now, the other thing I've seen damage kidneys are dietary oxalates, and we'll talk a little bit about that. And the other thing I've seen damage kidneys, gluten. We'll talk a little bit about how gluten can damage the kidneys and in which specific ways. And then in addition to that, things that not necessarily that they directly damage the kidneys, but can prevent the kidneys from repairing and healing, and that's nutritional deficiency. So nutritional deficiency oftentimes will prevent kidneys from recovering if a person's changing their diet and trying to do the right things within their diet. And so nutrients are super critical. That's why, again, some of these medicines, long-term can become a problem because they create nutritional issues. So now I'm going to put up a slide for you on gluten-induced kidney damage, because I want to show you some of the different ways that gluten has been shown, or that have been shown medically, that gluten can damage the kidneys. So how gluten causes kidney damage. So number one, gluten can cause or induce, some studies have shown that gluten causes inflammation of the kidneys. And this is just a generalized inflammation, systemic inflammation that can, over time, can do damage to the kidneys. One of the other things that we know is that gluten actually can create antibodies that damage the kidneys. So antibody formation or antibody increases that can damage the kidneys directly. There's a disease called IgA nephropathy. IgA nephropathy is a condition that most doctors will say, we need to give you immune suppressing medications for the rest of your life. They don't really know what causes it, but I have personally seen no less than about 50 cases of IgA nephropathy completely go away on a gluten-free diet, and I'm not the only one. There are other doctors who have reported this same type of outcome in the medical literature, and I'll show you some of that in just a minute. The other way, though, that gluten causes a problem is that gluten causes nutritional deficiencies. And it's kind of what I said earlier. The nutritional deficiencies over time can reduce the kidney's ability to function and reduce the kidney's ability to heal from that inflammatory damage. So we kind of get a catch-22 where we're inflamed, we're getting damage, and the way our body would typically heal that damage would be to use vitamins, minerals, and other nutrients in the process of repairing those damaged tissues. But again, when gluten's causing malabsorption and the potential for nutritional loss, it's very, very hard to recover even after going on a gluten-free diet, because going on a gluten-free diet doesn't just magically erase the years of malnutrition and malabsorption that have led to or can lead to those nutritional deficiencies. The other thing that gluten can do, and I mentioned here that oxalates, right, could create kidney damage, is that it's been shown that gluten can actually cause an increase in oxalates, and that can lead to an increased risk of kidney stones. One of the things that we see is that there's a particular kind of bacteria that live in your GI tract. They're supposed to live in your GI tract. It's called Oxalobacter, and the reason it's named Oxalobacter is because it's been identified as a bacteria that helps to break down dietary oxalates. Well, one of the things that gluten does is it damages the good bacteria, the healthy microflora. And gluten's not the only thing that does this. Antibiotics can do it as well. Whether it's prescription antibiotics or antibiotics in your food or antibiotics in your drinking water, etc. Antibiotics can knock out those good bacteria, as can gluten. And it can leave you in a state of reduced Oxalobacter populations in your gut, which can then, from dietary oxalate consumption, can lead to an increased level of oxalates. And it's oxalates that bind to calcium that form what are called calcium oxalate stones, or otherwise known as renal stones or kidney stones. And then those can get lodged in the kidney itself, creating, and if you've ever had a kidney stone, you can kind of mesh with me on this. They're one of the most painful things. Some people compare them to childbirth. Kidney stones can be extremely, extremely painful and create a lot of problems. And so as a form of kidney damage, right, oxalates plus calcium, and it's not the calcium that's the problem as much as it is the oxalates that are the problem, the oxalates themselves. So gluten can cause nutritional deficiencies, it can cause inflammation, it can cause elevation in antibodies that damage the kidney, but it can also reduce your body's ability to deal with oxalates, leading to kidney stone formation. So that's why, one of the reasons why we want to look at gluten, and we want to ask that question, especially if you've got any of these types of, if you've got chronic recurring kidney stones, if you've got IgA nephropathy, if you've got unexplainable kidney damage, you don't know why, if you've got diabetes and your kidneys are being damaged in that way, you really want to look at gluten and grains in your diet and make some decisions, make some tough decisions. My advice would be go read No Grain, No Pain and get on that diet program, and then have your doctor monitor these tests. And if you start seeing improvements in these tests, now other tests that you can run, since we talked a little bit about diabetes, is you can have your doctor measure that hemoglobin A1C, see if that's coming down, but also your blood glucose, your fasting insulin levels, important to measure as well. And so your blood glucose should really be somewhere between 60 and 90. Your hemoglobin A1C should be less than 5, and your insulin should be about 5, typically 5 or less. These numbers, for most people that have diabetes and kidney problems, their insulin's well up over 20, glucose is well up over 100, hemoglobin A1C oftentimes 6 or higher. But if you're there, monitor these values when you change your diet, because if you start seeing your values start to depreciate, come down, right? That's what we want to see. That means you're moving in the right direction biochemically. You might feel better physically, but we also want to make sure that you're moving in the right direction biochemically. So I want to throw up a couple of research studies for you. Let's throw up, let's see, number one there on, there you go. So this is a study. You see the result of this study is based on the finding of IgG1 EMA. EMA stands for anti-endomysial antibodies, or endomysial antibody. It's a type of antibody that's commonly found in people with gluten sensitivity. And what they found in this study is that people with IgA nephropathy, in other words, the antibody disease of the kidneys that generally is treated with immunosuppressants, that these individuals had high levels of endomysial antibodies and gluten sensitivity. And when they changed the diet, what was found is that the improvements in kidney function, right? So if you've been diagnosed with IgA nephropathy, I don't think I wrote that one down, IgA nephropathy, and you don't or haven't been tested for gluten sensitivity, that's one of the first things I would recommend you ask your doctor to do, is say, look, doc, I know I have this disease. You're not quite sure what causes it. Let's do a genetic test for gluten sensitivity. Let's look at the gluten sensitive genes. Let's see if I have them. If I do, let's do a gluten trial diet, and let's monitor my kidney function, and let's see if we don't get some improvement in outcomes. I've got so many people that have come to see me over the years where we've seen IgA nephropathy go away. And that's just with diet change. There's no medicine, just diet change alone is a powerful enough tool sometimes. And that's not saying that everybody in the world with IgA nephropathy is going to respond to a gluten-free diet. But again, it sure beats staying on an immunosuppressant for the rest of your life. It sure beats that if you can investigate gluten as playing a role in that issue. Let's throw up the next study here on the board for you. So in this particular research study, you see this is a case report of a patient with IgA nephropathy and celiac disease, and so you see just the summary of the article itself. The presence of high levels of IgA against food antigens, including gliadin and IgG and IgA and anti-endomysial antibodies in some patients with IgA nephropathy has raised the possibility of a pathophysiological link between IgAN, which is again immunoglobulin A, nephropathy, and celiac disease. So let me just kind of make that into English, because that's a lot of big words and a lot of medical words. What that basically means is people with IgA nephropathy may have gluten sensitivity, and the ones that we see where we test for anti-gluten antibodies, when we change their diet, their IgA nephropathy improves. So again, just what I was just saying, this is just more scientific evidence showing you that can be the case. Let's throw up the next study here on gluten and kidney disease. So you can see in this one, so this was a study published in the journal Nephrology, Dialysis Transplantation in 2009. But in this study, protein leakage dissipated on a gluten-free diet, meaning, remember what I said earlier, is that protein albumin is one of the signs of kidney damage, and if it's coming out too high in the urine, then it's an indicator that your kidneys have taken on damage. Well, this study showed that improved, the protein leaking through the kidneys, that started to improve on patients who went on a gluten-free diet. So the authors of this study point out that gluten-induced kidney damage can precede the onsets of the classic symptoms associated with celiac disease. So what does that mean? That means in some cases, what researchers believe is that the earliest warning signs of celiac disease or gluten-sensitive enteropathy happen to be kidney damage. And so, again, some people go to their doctor, they've been told they have kidney disease, but nobody ever really checked them for whether or not they had a gluten-related issue. And so they just go on in their life thinking their kidneys are damaged and thinking their kidneys are never going to make a recovery, taking very, very potent immune-suppressing medications until they don't work anymore. And so again, until you change your diet in these types of cases, you're just throwing medicine and you're symptomatically changing things without actually addressing the root cause of why the problem exists in the first place. So bottom line, if you've got kidney disease and you haven't investigated gluten as a potential possibility as to why that's happening, get with your doctor as soon as you can and ask him to run those tests. All right, so that's a general breakdown. Now I want to dive into some of your questions tonight. So let's see what we've got here. All righty. So Juan says, my postprandial cortisol was at 18.5 at around midday in general. Is this normal? 18.5 at midday? If you're talking around noon, it might be a little bit too high. Can ashwagandha, I'm assuming you mean ashwagandha, not ashwanda, but ashwagandha, can that help? It's an adrenal adaptogenic herb. It can help bring cortisol down through competitive inhibition with cortisol. It doesn't actually lower your cortisol, but it competes with your cortisol, and it has less of a cortisol-like effect. That's what an adaptogen does, is it competes with the hormone, but generally doesn't have the same type of effect that the hormone does. So, possibly, I'd say the bigger reason why your cortisol might be high in the afternoon like that might be stress-related. So look at things that are stress-related first, because the big things that elevate cortisol, aside from stress, are blood sugar disruption, lack of sleep, too much emotional or environmental stress. This is a perfect time for that right now. Many of you really, really hard pressed with the pandemic issue going on, and but look at those things first before you start taking adaptogenic herbs to try to address cortisol elevations. Let's see, good ways to support the kidneys. Question coming in. Probably the best way to support your kidneys is to eat the right diet. One of the most damaging things to the kidneys, hands down, bar none, is sugar. So don't eat sugar. The kidneys are a filter, and their job is to filter. Their job is to basically to detoxify your blood and filter your blood. So the best thing that you can do to support your kidneys isn't to take different herbals. It's not to take different supplements. It's to eat really well and to maintain good exercise so that you keep your blood sugar well controlled. That is fundamentally the best thing that you can do. And avoid taking medications if you can. If they're not necessary, avoiding medications, especially meds that are metabolized by the kidneys. Let's see, I think I answered that question already. The best way to identify kidney disease. I gave you some lab tests that, again, you can ask your doctor to run for you. Is it dangerous to have low urine pH? If so, what is the solution? Is it dangerous? It's a sign of a problem, but I wouldn't say it's necessarily an emergency or a danger. The best thing to do if you've got an acidic pH in your urine is to change your diet. For most people, that acidic urine like that is caused as a result of high processed food or excessive sugar. So changing your diet would be the first thing that I would look at doing, and continue to monitor that pH. And if it doesn't change, and it's probably best that you get with your doctor and have some more advanced type of testing run to make sure you head off a problem. Let's see. Gene says, how can I help my body as I have neuropathy? No pain, but numbness and pins and needles. Thanks. A lot of causes, Gene, for neuropathy. First of all, is it upper extremity or lower extremity? Did you rule out, disc herniations or nerve entrapment problems? That can be a cause of neuropathy. You can have nutritional deficiencies that cause neuropathy. Probably the pins and needle neuropathy that you briefly described there is oftentimes pins and needles can be B vitamin deficiencies. I've seen neuropathies like that be caused by B12 deficiency, folate deficiency, B6 deficiency. So again, getting with a good doc who understands these types of things and having the right set of labs run so that you can isolate and identify whether you have any of those nutritional deficits that might be contributing to that neuropathy. Okay, so let's see. So somebody's asking me about my watch. What is it with the watch people? There's so many watch people in our audience that always want to know about my watch. It's an Omega. If you're interested, it's an Omega watch. How about fruits? How can someone avoid grains and fruits on a vegan diet and still ensure adequate nutrition? That's a good one. So it's not about avoiding fruits. If if you're trying to follow a vegan diet, first of all, I would say, is the diet right for you? And maybe it's a conscious decision that you're making over animal rights or animal advocacy. But for some people, it's not the right diet. For some, it is. So that would be the first question that I would want to get answered. The second is, can you eat fruit? Yes, you can. You don't have to not eat fruit on a vegan diet. You just have to be cautious about quantity. It does become a quantity issue. Too much fruit is too much glucose and fructose. Fructose has to be metabolized by your liver, and so it puts a lot of pressure on the liver, can elevate serum triglycerides, among other things. So it's not that you can't eat fruit. I would say, again, if you're trying to follow the no grain, no pain diet, it's about avoidance of grain predominantly, but not necessarily total avoidance of fruit. So don't think you need to avoid all fruit. Let's see, GN. Hello, Dr. Osborne. Does premature gray hair lead to kidney failure in the future? Yeah, so your classmate had gray hair when she was 14. Last few years, she was on dialysis. So I would imagine if she had gray hair when she was 14, it's not the gray hair that caused the kidney problem. It was the gray hair that was an external symptom that said there's probably something very seriously wrong with a 14-year-old who's got gray hair. As a side note, there's a B vitamin, vitamin B5, pantothenic acid or pantothenate. That's not an 8, that's a 5. Also known as the anti-graying factor. And what will happen in some people is they'll get what's called a flag sign, which is they'll get patches of gray hair, and that'll show up prematurely, or they'll just get gray hair prematurely, but B5 deficiency can cause that. You need B5 to properly regulate the adrenal glands, which sit just on top of the kidneys. So there was probably a lot more going on with your classmate than just graying of the hair. If somebody would, potentially have maybe looked at or investigated it earlier, it's possible that it could have gone very, very differently. It's hard for me to say. There's just not enough information there. But graying of the hair is not necessarily a symptom of kidney failure, if that answers your question. So Jan wants to know, so how do you heal kidneys? The way you heal kidneys is you take away the things that damage them. Your body heals the kidneys. How do you heal a cut? How do you heal a scrape when you get a cut or a scrape? You don't. Your body does, if your body's healthy. So again, you all heard me emphasize this over and over and over again. You can use supplements, many people do, but if you try to use supplements in lieu of a good diet and a lifestyle change, you're going to be sorely disappointed in the outcome, and you're not going to heal anything. You're just going to be band-aiding, or what I call green medicine, which is when you try to chemically manipulate the symptoms that you're experiencing by taking something natural instead of taking a drug. It doesn't fix the problem. You always want to ask the question, why are the kidneys damaged? That's how you heal the kidneys. You take away what's damaging them and make sure you're providing for enough nutrition, the right nutrition, so that your kidneys have the capacity to heal. Your body will do the rest. Okay, let's see. So Brenda says, while toward the end of chemo for colon cancer, had swelling of the hands, feet called hand and foot syndrome, never realized the kidney was involved or the vitamin D function, still having issues 10 months later after last chemo treatment. Yeah, docs, and a lot of times the doctors are not going to tell you about vitamins because they're not trained in them. I mean, the vitamin D correlation, you'll never get that from a traditionally trained doc because they don't know it. It's just not part of their training. Leanne says, is discomfort or pain on the right side below the ribs related to the kidney? Is that its location? And if yes, what could that represent? So you're talking about the right side below the ribs. The right side below the ribs is typically the liver. Now, kidney pain, like from a referral pain pattern perspective, it generally is going to be across the low back. So a lot of times people will manifest pain across the low back. Now, it can wrap around, and in some cases it does, but it's more common for it to stay referred to the back area and less common for it to be here. Generally, if it's your kidneys, it hurts on both sides unless it's just a kidney stone on one side, because generally with systemic problems, you're going to see the pain represent or manifest on both sides, the radiating pain manifest on both sides. Whereas the liver's on the right, and you don't have a liver on the left; it's just on the right. So it's in my opinion, if we're just kind of looking at that question simply, I would ask your doc, potentially to do an ultrasound of your abdomen and see if there's any kind of fatty liver or anything else that's going on. And also at the same time, look at your kidneys while you're being investigated. Let's see here. How do you know if swelling is due to allergies or kidney problems? Questioning, testing, right? If you've got swelling from allergies, generally speaking, we're not going to see abnormal creatinine, blood urea nitrogen, or your GFR dropping below 60. Those are things that just generally don't tend to happen if you're having an allergy problem. But they do tend to happen if you're having a kidney problem. So, predominantly through testing and additional questions. Let's see. Can kidney damage be reversed if you stop the NSAIDs, antibiotics, gluten, etc.? Yes, it can, JD. It can definitely be reversed. I've seen it be reversed. I've seen people turn around. I've actually, somebody a few months ago that came to see me had late-stage kidney failure, and we got her bumped up to stage 2. So she was down to stage 4 kidney failure, which is, very dangerous. Stage 5 is dialysis. Stage 4, you're really close. And we got her, in a very short period of time up to stage 2 with diet change. So again, can you heal? Yes. I've seen it happen in a number of cases, but you've got to commit to the right diet. You've got to commit to healing. And that's where most people really struggle, is they struggle committing to the level that they need to commit to the diet changes. Let's see. So 80 wants to know, am gluten sensitive and B12 deficient? MCV is 103. MCV, for those of you who don't know, is mean corpuscular volume. How can you raise B12 levels fast before it worsens? Best way, I would say 80, my favorite way to raise B12 in people is using a sublingual. I have something called methylcobalamin, and the little tablet, we'll put a link up for you in the feed here, but the tablets, each tablet is about 5,000 micrograms of vitamin B12 in a methylcobalamin form, which is the most bioavailable form of vitamin B12. So it's the form your body utilizes and can work with the easiest. But because it's in a sublingual version, it will absorb into your cheeks. So if you've got a history of gluten-induced gastrointestinal damage, so like where vitamin B12 is absorbed in your intestine is the distal ileum. So the furthest area of your small intestine is where vitamin B12 is absorbed for most people. And if that's been damaged by years of gluten exposure, then going through the cheeks bypasses that GI tract. And so it can be a very, very effective way at getting B12 in you quicker and getting your levels up in a better way. Okay. Cheryl says, my fasting blood glucose is always above 120, but my A1C is around 5 to 5.5. Do I need to be concerned? Yes. I would look at, if your fasting blood sugar is always above 120, why? And so I would maybe, if you don't already have a glucose monitor for home use, I would check it several mornings in a row and then check it several periods throughout the day and see how it's running. And if it's dropping dramatically and it's just elevated because maybe when you have it checked, you've gone to the doctor and you're super stressed because you're in a doctor's office. Remember that stress causes cortisol to dump sugar into your, to have the liver dump sugar or glucose into your bloodstream. So you can get an artificially elevated reading of glucose in the mornings if you're stressed out in the doctor's office. So it may be a fluke of the testing, but if you have a home monitor, you can check it at home where you're not so stressed maybe and see if that same thing is happening. But yeah, I would be very concerned about a consistent level of fasting glucose at 120, even if your hemoglobin A1C is in a normal range. Let's see here. Deborah wants to know, if a person has one kidney only and a GFR 50, what is a safe dosage of vitamin C as well as other supplements It's a big question, Deborah. I'd say the best answer I could give you is get with a qualified nutritional doc to work a nutritional protocol out for you, or even to determine whether or not you need supplements. You may need a lot less than what you think, and that's where testing can have a huge advantage for you. But it's hard for me to really comment on what is the adequate dose with just that small amount of information. I don't think I would do you a justice or a good service. Jean says, can you please tell me anything to help neuropathy? I have no pain, but numbness and tingling. I think I answered a similar question like that just a few minutes ago. So default back to the answer that I shared. Let's see, Betty says, besides limiting glucose, what other diet is best to support kidney function, specifically minimum change disease? What we think was triggered from a shingles vaccine. Boy, yeah. Time. Limiting glucose, potentially, depending on, again, this answer is not universal, Betty, so I hate to generalize. I'm going to generalize with you, but I might not be accurate for you. And that is lower your protein intake. So there are cases where, a lot of times doctors will recommend with kidney function issues, they'll recommend a low protein diet. And that's because the kidneys have to filter the nitrogen and the creatinine. Again, that's that blood urea nitrogen. That's coming from the metabolic breakdown of proteins. And so the more protein you eat in your diet, sometimes the more pressure you can put on the kidneys. I don't generally, for a healthy person, recommend a lower protein diet, but in some cases where you've got, a mechanism of kidney damage, even included in something like a vaccine, you might want to spend some time with a lower protein diet, or just taking in lower protein for a time, not necessarily even permanently, just to give your kidneys a break from the filtration. But it's really hard to answer that because there are a lot of other potentials that could go into that equation. Nancy asks, can some oil have gluten? Define what that means for me a little bit more, Nancy. I mean, some oils can be cross-contaminated with gluten, but it depends on where they're manufactured, where they're made, what the manufacturer is also producing. So, I mean, there's the potential there for cross-contamination of gluten. But if you're just buying like an olive oil, for example, an extra virgin cold-pressed olive oil that's organic, it would not be the top of my list of suspicion that it would contain gluten in it or gluten contamination. Let's see, Jody, I have been diagnosed with PKD stage 0, which was accidentally found on a CT scan. What would cause this? And what would you recommend to eradicate or keep these small cysts from growing, affecting my kidney function going forward? Jody, that's too challenging of a question in this type of format. What I would recommend is that you get with a good functional doctor who's worked with PKD before, and get the accurate and adequate testing so that you can get super detailed and super linear on what you need to be doing. Because otherwise it's just a big guess, and that might not be the best service for you. Okay. Let's see. Thank you. I like hearing that. Thanks for your kind words, Louise. Louise says, thank you for your advice. It's helped my family so much over the years. Removing gluten and taking Creon completely healed my son of severe eczema. Hallelujah. For those of you who don't know what Creon is, it's a pancreatic enzyme. Some people with gluten-induced damage long-term, it damages their pancreas. They can't produce the digestive enzymes the way they otherwise could, and then they're not digesting their food. So their undigested food creates leaky gut in perpetuity, causing systemic-wide inflammation and protein and bacterial leakage into the bloodstream that starts to manifest in the skin as eczema. So, yeah, awesome that you've gotten that help. Let's see, Donna says, can frequent urination be a sign for other things, or is it specific to kidney function? Now, a frequent urinary urgency can be a sign, well, for men, it can be a sign of a prostate enlargement. For women, it can be a sign of a urinary tract infection, which isn't technically major kidney disease. UTIs happen quite frequently for a lot of women. It could be yeast overgrowth, so it could be other things than direct kidney damage. Brenda says, how to share with someone that is not on Facebook at all. Brenda, go over to my YouTube channel. We live stream to that channel as well. It's youtube.com/glutenology. And you can take the link of any of our videos, and you can share those links with anyone. And we encourage all of you to do that. If you're not subscribed to my YouTube channel, it's one of the best ways to get updates in terms of when I do a live video or when we produce new videos. If you hit that subscribe button on YouTube, and then there's a little bell notification that you hit after you hit subscribe, what that'll allow YouTube to do is send you a reminder anytime we have new video that comes out for you guys to get educated with. Let's see, if someone has a new spinal cord injury or something like a Guillain-Barré, what do you recommend? Yeah, I recommend getting with a doctor as soon as possible and getting a full workup done, because that's not something you want to mess around with. Guillain-Barré can progress and become a very dangerous problem, so you don't want to mess around with that. And it's too broad and big of a question for this format. Okay. We're just about out of time here. Does MS cause insulin resistance? I would say MS doesn't necessarily cause, MS meaning multiple sclerosis, doesn't cause insulin resistance. It's more like, does insulin resistance contribute to MS? It's more kind of think of it in the opposite way. MS is an autoimmune condition where your immune system is creating antibody proteins that are demyelinating your central nervous system. And that is a very, very big problem. And that generally, for most people in my experience, is solved by diet changes and food changes and nutritional changes. So again, being an autoimmune disease, there are 4 primary triggers for autoimmune disease. Food is one of them. Chemical exposures is another. Microbial imbalance and the nutritional deficit is another trigger. So addressing those 4 biochemical triggers with any form of autoimmune disease is often the best first step that anybody can take in order to begin the process of improving their health. Okay. All right, we'll end with a positive note. Lisa says, this info has been so helpful. I've had puffy eyes but never had other symptoms till this month. Started getting pain in my back at night, and more recently, cannot sleep at night. It all makes sense now. Thank you. You're welcome, Lisa. And make sure in the coming up weeks, as you get that checked out, make sure you let us know how you're doing and let us know what the outcome of that was. Look, folks, I'm out of time. It was wonderful spending Monday evening with you. If you're new to the show and you want more, make sure, again, you subscribe to our YouTube channel, but also come visit me at glutenfreesociety.org. It's our foundation where we talk about how to navigate the gluten-free diet in the right way, not the incorrect way, but in the proper way. And make sure you sign up for our newsletter there. We give you lots of free information on a weekly basis. We send out a newsletter with tons of information to help you navigate diet and lifestyle changes without feeling lost and confused and alone. So we'll see you all next week, same time, 6 p.m. for another episode of Pick Dr. Osborne's Brain. Have a fantastic week. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.